we're going to be taking a look at Tehya this morning, and Dr. Rantanen will be doing a detailed scan on her and communicating to us his findings.
Remember, it's cold, Jeff. The scan heads are cold, the gel's cold, the leg's cold, and what have you. It cuts down on the transmission of sound, so you kind of have to fuss with it to get the image right. So what we're going to do is save video clips. I'm going to go down the tendon one time and just look at everything. And it takes a while for the skin to soak up the gel. Want to make sure our quality's good enough. You can see the linear stuff now, Jeff, that we've talked about before. The small fiber separations and what have you that make up the tendon. So it gives us a chance then to go through and look at all the different levels.
So ideally then, you would prefer not to see any kind of separation?
There has to be a little bit of separation, and some horses in training there will be a little bit of separation, but if it gets to be too much, or it affects the size of the tendon, outside of a normal range or more than the opposite tendon, then it's too much. Then it's inflammation, and it's causing the fiber separation. And chronic congested, inflamed tendons then lead to fibrosis, so they end up in their 4- and 5-year-old year with a big thick tendon, and some of those will come apart because they lose their elasticity. Scanning techniques to evaluate the tissue. You can see when I tip the scan head just ever so slightly that we form a big band right across here in the center of the tendon. And we've got another technique called cross-beam scanning that we're using with this GE instrument that reduces the speckle that's normally associated with with ultrasound scans. And we've got the left side that has the normal speckle, and we're running a paired sample. So this is cross-beam off, this is cross-beam on, cross-beam off. And we're seeing a difference in the appearance of the tendon, because on the right-hand side we're getting a little better detail, and you have to look carefully. It probably won't show on your thing, but a lot of the stuff that we're seeing here has a speckle. You can even see the speckle up in the area the standoff pad is gone on this cross-beam scanning, and what it means is the sound beam is coming at this tendon from different angles. Normally it comes out in a 90-degree orientation, but with the cross-beam scanning they have beam coming from different angles, and it hits different parts of the tendon, so we can confirm fluid within a tendon a lot easier. We can find areas of scar tissue as well. Okay, so we got enough on this tendon. So, I didn't see any focal lesions there, Jeff, on that side.
Doctor, what does that mean when you say focal lesions?
An accumulation of fluid within the tendon, or an area where the tendon fibers are torn and there's hemorrhage. That usually shows up as a dark spot within the tendon. So
clearly then that's a good sign so far on that particular issue.
And we don't like to see that. If we deal with an inflammation like some of the ones that you and I have looked at in the past, and we have inflammation between those tendon fibers, and we can get rid of that, then it's game over. There's no lesion to heal up. In other words, no defect that we have to fill up with scar tissue.
Right.
And if we get rid of the inflammatory response, collapse those fibers down together, proceed at an exercise level, and see if the tendon is stable. And if it's stable at our guess on the first exercise level, then we just gradually increase the exercise level until we get back into the saddle again. If we have a lesion to heal up, an actual physical defect, then that's what takes the time. That's the 10 to 12 month thing that we've talked about before.
Okay.
But an inflammatory response with enlargement is much different than that. Okay, and your learned eye, you probably picked up on what I just went over.
Oh, yeah. But for those who haven't, can we explain it a little bit?
Sure. When I slide down this tendon, I'm looking at a fairly normal shaped tendon as I come down through the middle. When I get down to this area right here, the inside of that tendon enlarges. You can see that our fiber pattern changes right here.
Sure.
So in this particular site then, we have an area that probably has some small focal hemorrhage and what have you, plus edema within the tendon, and that's causing that tendon to have an enlarged medial border. We have an area that probably has some small focal hemorrhage and what have you.
In terms of the location on the tendon, whether it's high, low, or in the middle, does that carry any weight in terms of prognosis for healing?
The lower you go, the worse it is.
In terms of the
And
location
the old
on the
timers had
tendon,
that
whether it's
figured out.
high, low, or in the
I
middle,
like to think
does that
of them being older than I am.
carry any
But
weight in terms
they had it
of
figured out. They
prognosis for
called it
healing?
low blow. You had a quote low blow, then you were in real trouble. If you get down into the pastor, then you're in real trouble. If you hurt the flexor tendon as it goes into the pastor, it's pretty tough to get those horses back. If you get down into the
And the area of concern on this particular filly, would you say we're in a good location?
no, it's pretty tough. No, we're not. We're right down here at the lower zone of the tendon.
And the
It's on
area of
medial
concern
side.
on this particular
Enough
filly,
tendon enlargement for
would
us
you
to
say
pick it
we're
up
in a good
visually,
location?
palpably, what have you. So you did the best thing on this horse was to stop. You can even see it on this little thumbnail down here. You can see that dark area right there shows pretty good. And then when I blow that image out, then we can thumbnail down here. You can see that. You can see that dark area right there shows pretty
Right.
good. And then when I blow that image out, then. So that needs to be addressed. This is something that's acute, where it certainly has acute changes in it. It's got
Right.
fluid accumulation. It most likely has some hemorrhage. It most likely has that needs to be addressed. This is something that's acute. And the thing, like we stressed before when I talked to you about fluid accumulation, and when we have a tendon like this is when we have to turn them over to somebody like this eruption in that area. That will give them the time and the effort before when I talk to you about your compressive pull therapy. We have a tendon like this is collapsed down as rapidly as somebody like Hank. Recheck it in 4 to 6 weeks to see how the time and the effort and that compressive exercise level to get this thing to collapse down as rapidly as we can. Will recheck it in 4 to 6 weeks to see how we're doing, and then make a guess at that time on what kind of exercise. But my guess is that she's probably going to be walking, which I think it probably will, based on what we're seeing this horse, or whether or not we want to.
And so with the cold compressive therapy, as you mentioned, you go ahead and treat for a month or so, evaluate, and in terms of the time frame for using cold compressive therapy, as you mentioned, you go ahead and treat for a month or so, evaluate, and in terms of the time frame for using that type of therapy, would your expectation be that it's a couple months worth of use, or?
Probably at least that. Some of them collapse down the next time you see the site. And those, the basic thing is that if it, and of course, if it collapses quickly, you're going to respond. Some of them collapse down the next time you look to see the site. And those, the basic thing is that if it if it collapses quickly, abnormal fiber pattern, then that means that our prognosis is that it was really increased 10%. We're going to be more successful. If the tendon stays big,
Gotcha.
it's an abnormal fiber pattern. We can't
And from a
make it
total time off,
the same size
understanding that
that it
there's
was
still a
with
lot to be
5 or
learned as we
10%,
go through the
our
process
prognosis is
of
less
healing
for
her.
that tendon to hold at racing speed.
Gotcha. Best case scenario in terms of
And from a
back
total
to
time
where
off,
she'd be ready to run
understanding
the
that
race,
there's
we're
still a
looking
lot
at
to be
anywhere
learned
from
as we go through the
9 to
process
12 months
of healing her.
Best case scenario in terms of back to where she'd be ready to run in a race, we're looking at anywhere from 9 to 12 months.
Probably. To be on the conservative side, that would be the best guess. Now, as I turn this scan head and do some off-angle scanning, called echolucent.
We'll talk about it whenever you get here. Okay.
If we get fluid, we're going to see that this site stays what we call echolucent. Because if we hit fluid at a different angle, it's still going to have the same appearance. If we hit scar tissue at a different angle, it's going to have a brighter appearance than the fluid. And brighter than it was when we look at it straight from the back of the tendon. So what this crossbeam does and what the off-angle scanning does is it helps us to differentiate between fluid, and it helps us to find areas of fibrosis within the tendon where the fibers are aligned. Because misaligned fibers looking straight from the back of the tendon will look darker, but if we hit them at an off angle, they may look brighter because we're hitting their fibers at a different angle, and we can confirm sometimes stage the age of the tissues.